A healthier, happier life begins here. Welcome to Mercy Moments, a podcast by Mercy Health in association with True Chat.
For many, 2020 has been a very challenging year. That's because, in addition to the usual trials and tribulations of life, we've had to deal with an ongoing pandemic. Things like social distancing, herd immunity, and flattening the curve have become an integral part of our vocabulary. Therefore, we thought that we would use the last episode of the year as a sort of recap to reflect upon what has taken place, where we stand today with the vaccine, and things to look forward to in the future. Thank you for tuning in today. I'm your host for Mercy Moments, T. Allen Sealer, coming to you from Champaign County here at True Chat Studios in Urbana, Ohio. For almost half a decade, he has been the health commissioner for the Champaign County Health District. And before that, he was an epidemiologist for the Clark County Combined Health District. Please welcome to the program, Gabe Jones. Gabe, welcome.
Thanks for having me.
She is currently the community paramedic for Champaign County and has served as an ER endoscopy and surgical nurse. Please welcome Cheryl Weirs back to the program. Cheryl, welcome back.
Thank you for having me.
So, Gabe, my first question is to you. What surprised you most about the pandemic?
I think the thing that surprised me the most, with a lot of uncertainty early on, was the different ways that this particular disease impacted people, from a broad spectrum of symptoms to no symptoms at all, and having a hard time knowing the best way to mitigate disease spread. Over time, we've had to adapt and come up with new ways in terms of messaging in order to have more cooperation from the public, better understanding, because without a vaccine, our most effective tools have been quarantine and isolation, and then all of the hygiene practices that would reduce disease spread. So I'm now at the point where so much has happened that really nothing would surprise me. If it was another disease that popped up or something totally new with this disease, we at the health district have continued to learn how to adapt, and when anything else would pop up, we'd certainly be prepared for it.
Yeah, for me, I would say it's ease of transmission. That it seems like when, because of how long it takes to detect symptoms, by the time, you find somebody that's positive, he or she's already spread it to several other people. It just seems like this year in particular, it's very easy to spread that. So Cheryl, this question's for you. What area of society do you feel has been impacted the most?
Honestly, I feel like every area of society has been impacted. The financial impact, you have stores closing, businesses are struggling, you have people losing their jobs, they can't afford food and rent. From the physical and psychological effect, you have the social distancing. You've got people, that you've got family, you can't hug them, you can't get close to them, the 6 feet apart and all that. It affects everybody in all parts of society.
Yeah, you wouldn't think that just the little things like hanging out with your family and things like that but once it's not there, then, you appreciate it a little more. So Gabe, how has the coronavirus affected how we deal with change?
I think society as a whole has, as a result of a brand new disease like this and all of the social and political impacts that it's had, forced them to be more flexible, become more adaptable. And then, from a public health standpoint, us learning new things and have to put out new information almost on a daily basis, people have had to absorb that and change their practices very quickly. So I think on the whole, it was a struggle early on, but now that people have learned to adapt and learn all of these new things that we have. A lot of the times in public health, we were learning things at the same time as the general public. And so, we've had to roll with the punches and everyone else has as well. And I think society, for the most part, has really had to change, and there really hasn't been a choice in it.
So Cheryl, has society become weaker, stronger, or stayed the same?
I feel society's been stronger. I believe we're going to emerge from this even stronger. And a lot of it goes back to what Gabe just said. We have learned so much from this pandemic, and we've been forced to change so that in the future we may be able to change without being forced to do so. We can look ahead and say, we need to make some changes. Let's get that done so that we're not in a situation like we are today.
Yeah, it's definitely an era of flexibility. If right now, if you don't get on the change bandwagon, you're going to get left behind. So Gabe, what is the most important thing that you've learned from the pandemic?
That's a really hard thing to just pinpoint one thing because we've learned so much. I guess for us at the health district, it's been really the messaging piece and how we craft the message in a way that everyone can understand it, everyone can hopefully agree with it, agree with the thought behind it, and make the necessary changes that they need to in order to protect themselves and their loved ones. Public information before was us putting together a press release and putting it out whenever something popped up in public health. But now it's an expectation that the community wants data from us, wants information from us daily, and us almost having to reorganize our entire structure and put something together to where we are satisfying those needs has been something that in public health we really have become more learned in, more flexible, more everything before that we were doing pretty much had to rewrite the script. So I think with the whole social media, public information, all of that, it's something that we really beefed up at our smaller department and are continuing to improve upon and come up with new ways to get information out there.
So Cheryl, same question.
So one of the things I feel is most important that we've learned is how interdependent we are on each other. What one person does affects so many other people. And that may be the person sitting across the table from you. That may be the person at work. That may be the person across the world. This does not start here, and it came here. So, it's amazing how we've learned how fast that can spread and how what you do personally can affect someone else.
I'd like to take this time to remind our listeners that all of True Chat's podcasts help pursue a common goal: to educate people by providing honest, open, and respectful conversations. To learn more about Mercy Moments and to find out where you can listen, please visit us at mercymoments.org. So just to recap, our conversation today has been about COVID-19, our ability to cope with it, and the wonderful things still going on in the community. My guests today are Gabe Jones and Cheryl Weirs. Let's continue the conversation. So Cheryl, how close are we to actually getting a vaccine?
Well, the Pfizer vaccine is already out and being distributed right now. And the Moderna, it has also been approved, and it is going to be out this week, I think today or tomorrow. So they're out there. You just have to get them out to the public.
Yeah, I read that that we should have close to 300 million doses by first quarter of next year, which is an astounding number. And with 40 million being available here in the short term in two different rollouts. So Gabe, how long will it take to work, and how many doses will be needed?
So right now there are 2 vaccines that have emergency use authorization. That's the Pfizer vaccine and the Moderna vaccine. Both of them are similar in terms of their mechanism for how they work, but they are a little different in terms of storage and some other technical things. Typically, they take about 2 weeks post second dose inoculation in order to be what we would consider effective. And these two vaccines are 2 doses. The Pfizer vaccine is 21 days between first and second dose, and the Moderna vaccine is 28 days.
Are there any special considerations as far as storage and things like that?
There are, yeah. So with the Pfizer vaccine, it requires ultra cold storage. So you'd be looking at right around negative 80 degrees Fahrenheit. Wow. And with the Moderna vaccine, just regular freezer like we have for our varicella vaccine. So that's the vaccine that we'll be receiving at the health district. Initially will be the Moderna vaccine.
So how has the various entities actually handled that?
So we've been collaborating with the state since the very beginning of the pandemic, and they have coordinated the process for news in terms of all of the new things with the vaccines as they've been in development and going through the various trials. And what we're doing locally is working with our healthcare partners within our region. Springfield Regional Hospital has been talking to us for months now in terms of what they are expecting with the Pfizer vaccine, them being the hospital within our region that is going to be receiving that particular vaccine, and the coordination amongst who all it's going out to, the various tiers, those who would be receiving the vaccine first. So the state has been sort of the umbrella over all of this, but a lot of our regional and local partners have been instrumental in putting all of this together and coordinating everything so that, with the day actually being here that people are going to be getting the vaccine, we're in a very good place for how we're going to be doing that. That's a testament to all the partnerships and regular communications throughout all of this, which without, we'd be pretty lost right now.
So Gabe, that's a good point. So who exactly is going to get the vaccine first?
So we have various tiers that we put together, and that's based on Ohio guidance, which is operating under federal guidance. And what we're doing locally as we receive these doses into our facility, knowing that they're going to be restricted in terms of how many we can get out at one time. We're looking at doing this on a weekly basis. Initially, it's going to be sort of just trickling into the health district in terms of the number of doses that we receive, and that's the same for the hospital as well. And then we do anticipate the floodgates to open somewhat and get more and more vaccine so that once a cadence is established, we can get that out to the various groups. And those who are going to be receiving it first will be those who are at highest risk. So all of our long-term care facilities, those who are interacting directly with COVID-19 patients, suspected COVID-19 patients, those at the health district who are going to be coordinating these clinics that we're going to be setting up throughout the course of this rollout. All of those people are going to be the first people to receive the vaccine. And then when subsequent tiers come out and are established, we're going to be prioritizing those locally as well.
So considering all the different levels that are involved, where did you have your, I guess you'd say, biggest challenge?
I think initially, just with the dearth of information that was available to us, just really knowing what was going to be happening. There was an uncertainty early on which vaccine was going to be coming out first, if it was even going to be coming out, if the emergency use authorization was going to be happening. So not having that information was hard for us from a preparation standpoint. We have all of these plans in place, these continuity of operations plans, and everything that is set up to, put something together based on information. But without that, we were just kind of flying blind for a bit. But slowly it started to come out. The state was, getting us more and more information. And now I can barely keep up with all the emails that I'm getting, just, with everything that is new and changing. And right now it's only 2 vaccines. So that's been the hardest part. And I think now that, this is our first week of distribution, and of course, Springfield Regional started last week. As we do things like this, it's always a cycle for us to try something out, assess, reevaluate, and make whatever changes are necessary. So we do anticipate that early on there will be some logistical kinks in terms of scheduling, other issues with 2 holidays on the near horizon. So trying to ensure that everything is coming out in a timely manner and the best manner possible, so that we get as many people vaccinated as quickly as possible, is going to be vital for us, because we know how dangerous this disease is, and we know how important a quick vaccination process is going to be for stemming this particular disease.
So, Gabe, as far as administering the vaccine, how's the process work?
So at the health district, we'll be receiving some doses on a weekly basis, and then Springfield Regional will be receiving doses as well to go out to those various locations. All of the long-term care facilities will be taken care of either by the healthcare provider, which they work for, or CVS or Walgreens. And here locally, with us getting more and more vaccine on a weekly basis, we have various points of dispensing sites throughout the county that will be going out to, initially with the dosages being fairly small. We'll have people coming into our department to receive the vaccine. All of them initially are getting scheduled. But at some point, we're going to open it up and have a larger clinic, something that we typically do with flu, with H1N1 in the past. We've opened up a larger flu clinic for the general public. And we are going to be having that at the fairgrounds at some point in the near future, hopefully, to get more of the general population vaccinated.
So, Cheryl, in regards to administering the doses, who's going to get it first?
So those healthcare workers that are working directly with COVID patients, caring for those, or those that could be exposed. The other frontline workers as well that are in the hospitals that have, they're in the rooms, and then nursing homes, in the long-term care facilities for those people that are not only just working there, but for the residents of those facilities. Those will be the first to get the vaccine. After the healthcare workers, and I forgot to add too that the fire departments, all of those folks will be getting them in the first line as well. So then after that, that's where Gabe was talking about setting up those pods, where you can go out and where the general public then can go get them. First going to those that have like immunocompromised or have health conditions. And then after that, opened up to the general public.
So Gabe, final question. How long do you think it'll take for us to finally get back to some sense of normalcy?
Good question. I don't foresee us ever really going back to how things were pre-pandemic. This has changed society on a huge scale. I guess from a health standpoint, we would be hopefully looking at getting a large chunk of the population vaccinated which from a public health standpoint, we know is the most effective way of preventing disease, along with all the other tools we have in our toolkits to stem the spread of COVID as well as other diseases. So I would hope, I'm an optimist, so I'm hoping sometime in 2021, we have a larger part of the population vaccinated. We start to get that herd immunity that you had talked about earlier, where those who maybe are still hesitant about receiving the vaccine, those who maybe can't for whatever reason receive the vaccine, if it's a medical contraindication, they would be covered in a herd sense, like we do with all of our other vaccines that we provide for the other infectious diseases out there. And I would hope by fall of 2021, it's not only COVID that we're talking about, but, it's not the forefront of the conversation like it is now. We'll be talking about it at the same magnitude as we are flu and everything else.
What's one thing you missed during the pandemic and we'll look forward to doing next year?
I would have to say that would be seeing family. The majority of my family lives out of state in New York, Chicago, Michigan. The Zoom is great, but there's nothing like actually being with family and being able to, be right there with them. So that's the one thing I will probably look forward to.
Gabe, I'll ask you the same question.
I'll echo what Cheryl said. Seeing my friends, seeing my family without a mask, being able to hug my parents, be with those that I haven't been able to see. I've either been too busy or, just with the physical limitations, just haven't been able to do that. And then also a vacation would be nice. Something to get away from COVID. And I think public health has changed drastically. We have somewhat always been in the shadows, never really coming to the forefront until, something came up and, we were needed. I would hope that people recognize the importance of public health, ways to prevent disease spread amongst the population at a population level. And in the future, we'll hopefully, kind of go back into the shadows, but I don't want people to ever forget about the effective ways of protecting themselves and protecting their loved ones.
Those are great points. And I think it's the little things like shopping, going to the gym that, we tend to miss. I mean, with social distancing, it makes things that we normally don't even think about when we do very challenging. Again, I'd like to thank my guests today, Gabe Jones and Cheryl Weirs, for being here. You can listen to Mercy Moments on TrueChat via Spotify, Apple Podcasts, Stitcher, or anywhere else fine podcasts are found. For Mercy Moments, Mercy Health Urbana Hospital, and TrueChat, I'm your host, T. Allen Sealer.
I'm Gabe Jones.
And I'm Cheryl Weirs.
Thank you for listening today. Stay healthy, Ohio.